We are very fortunate to have Jen Flory, who is the director of the Cancer Legal Resource Center, a joint project of Disability Rights Law Center and Loyola Law School, Los Angeles. Prior to joining the CLRC, she was the supervising attorney of the Health Consumer Center at Neighborhood Legal Services of Los Angeles County, where she supervised the center's consumer assistance hotlines and the legal work of pre-medical legal community partnerships. Jen started her legal career as an advocate at Western Center on Law and Poverty, specializing in medical debt and preserving public benefits for low-income Californians. Jen has also worked as an immigration attorney in London and taught writing in community colleges. She is a graduate of USC Gould School of Law and holds a MA in Comparative Literature from Penn State and a BA in English and Spanish from Chapman University in her hometown of Orange, California. She spends all her free time outdoors. Would you please welcome Jen Flory?
Yeah, it's, if you just, where it says from the beginning in the far left,
Okay.
that should get us where we want to be. Okay. Well, what my intro didn't say is that I actually do kind of consider Riverside a bit of a second home because my dad's family lived in Glen Avon until about 7 years ago when they built the new high school there. That was where they had their horses and everything. So I was out here all the time for Thanksgiving, Christmas, and most major family holidays. So it felt a little bit like coming home again, driving down the 60, and a lot has changed. So before I start my presentation, I just want to kind of get an idea of where you guys are at when it comes to Medicare. How many of you, either for yourself or a loved one that you work with, have enrolled in Medicare before? Okay, some of you. And some of you, how many of you are going to be facing that for yourself or for one of your loved ones? Okay. How many of you guys think you understand Medicare? Now, I don't know that I can promise full understanding of Medicare at the end of this short presentation, but by the end of it, you should be able to identify what the 4 major parts of Medicare are. You should be able to identify some of the things that you'll probably want to consider when deciding which part makes most sense for you. And then you will also, I'll tell you a little bit about some of the changes that health reform has brought to the Medicare program, but I'm only going to focus on the ones that affect the beneficiaries. You've probably heard it a lot in the news about how it affects doctors and hospitals. That is true. They are not probably as happy about it as the beneficiaries, but I want to make sure that you guys understand the things that are most pertinent to you. And then one other caveat, I was traveling a lot this week and I realized that they printed slides that were slightly old. So there will be 1 or 2 variances when we get to the figures for Part D and the premium for Part B. The correct ones will be on the screen. The good news is the figures are better, premiums have dropped. So usually things don't work out that way, but there's actually some good news. And the one last thing before I get into it, for those of you that are enrolling like this year, I put this booklet out there. It's called Medicare and You. It's actually one of the better booklets that the government does for such a complex subject. And there's also a couple copies in Spanish. If we do run out, or if you need it for the future, like you are not going to be enrolling until 2013 or 2014, you can always just call 1-800-MEDICARE and they'll send these books out free. So before we get on to Medicare, I'll just give you a little bit about where I work at. It's the Cancer Legal Resource Center, and it was a project that started with one attorney in basically a closet almost on Loyola Law School's campus. They had this idea that a lot of people who have cancer, part of the stressors is not even so much just fighting the disease, it's all of the other things and choices that you suddenly have to make beyond the medical treatment, whether it's trying to figure out your health insurance, trying to figure out how much time you can take off work, trying to figure out disability benefits. All of those things are actually somewhat legal issues. So we started this program to set up as an information and resource center for people who are going through cancer and have these types of legal questions. So this talks about, so we did start at Loyola Law School, Los Angeles, and then what happened is once we got a little bigger than just one attorney, we needed a little bit of infrastructure, like some people to help us with our tech and our administration and things like that. So we were actually adopted by a larger nonprofit called Disability Rights Legal Center. So we're now housed within that nonprofit, but we're still our own program. And so we do offer confidential services. I put some of our cards back there that have our hotline number, and it's also on the slides. So if you do, after this presentation or any time in the future, you have a specific question, you're welcome to call our hotline, or you can do an online intake, and we'll give you the resources that you need. Also, for those of you that like surfing the web, we have a lot of resources online. We have whole manuals online, and they're all free to download, free to access. One of the larger ones that we have is called the Healthcare Professionals Manual, and it basically takes most of the areas of law that we cover and puts it into kind of an outline form. We also, for a lot of our materials, do have them in Spanish as well, so if you're helping somebody who doesn't read English or would prefer materials in Spanish, you can check our website for that as well. We have been averaging about 400 calls a month. So if you do call us, it might take a day or so to get things sorted out because we're a small staff of 6 attorneys. But we also have a lot of help of the law students at Loyola Law School, and so it's a great project where they get to start right away before they even start their legal career and get a little better idea of what real people are going through before they go and try to be fancy lawyers. So, and then people always ask us, so what's legal about cancer? What is this you're doing? And this is just an overview of the areas that we do cover. Probably the biggest 2 areas that we cover are health insurance issues and employment issues, whether that's taking time off work or occasionally you still do see employment discrimination. We think it doesn't happen anymore, but it does. Okay, so I do want to do a little vocabulary first. A lot of times, and you'll even hear this from elected officials, that they confuse Medicare and Medicaid. These are 2 very different programs. What we're talking about today is Medicare. This is the program that is considered a social insurance program. That means basically you have been paying into it, so at some point you'll take out of it. So that is for people who are age 65 and over, or for people who are also receiving SSDI, those long-term disability benefits, after they've received their SSDI for 24 months. Now, the program that it is often confused with is Medicaid, and that is it's an entitlement program that's for people with very limited resources. Here in California, to add to the confusion, we don't even call it Medicaid, we call it Medi-Cal, and Medi-Cal sometimes sounds like Medicare, so that's I think where some of the confusion comes in. And to make it even more complicated, if you do have limited income and assets, it's possible that you're getting both, and you have to figure out how those work out together. Both of them are run by the Center for Medicare and Medicaid Society, and for some reason it has only one M in their abbreviation. Okay, so like I briefly mentioned, there are 2 ways to get it. The first is what most people, they just turn 65 and all of a sudden they find out that they're going to not be able to use their employer insurance like they could, or they were retired. And then the other that often happens with a cancer diagnosis is people who have been on SSDI for 2 years. They suddenly become eligible for Medicare as well. So they start on it a little earlier than 65. Just a few, yes?
If I'm 62, I don't do a thing yet? I just wait?
You just wait unless you've been on SSDI.
Oh, well.
Yeah. So if you've been on SSDI for 2 years, then you can apply for it.
That's
And we'll talk about when you want to apply for it too. Yes. So just to know that 48 million Americans were covered by Medicare in 2011, so it is our largest insurance program. And 8 million of those are people who are under 65, so they have it because of a disability that they have, whether it's cancer, another chronic disease, or what we more traditionally think of as disabilities. You know, for example, they might be blind or something like that, and they can't work normally. 57% of them are women, and we think that's just because women tend to live a little longer. So, and then it is 15% of our total federal budget right now. So the Center for Medicare and Medicaid Services that I mentioned before only abbreviates itself CMS. But the 1-800-Medicare, if you ever need information from them, they're usually very happy to send things out. In fact, they'll send you things sometimes when you don't ask for it. Okay, so we'll get to the 4 parts now. The first part is called Part A. It was the original Medicare program. When Medicare was passed originally back in the 60s, healthcare was a lot different than it is now. It wasn't so expensive to go to your regular doctor. There weren't so many specialists, and when people were talking about health expenses that they couldn't pay, it was hospital expenses. So Part A just covers hospital insurance, so if you're an inpatient at the hospital, it was also different. People weren't doing so much outpatient services at hospitals. It was either you were so sick that you were in, or you probably were just getting care from a primary care physician. So it covers inpatient and then skilled nursing facilities, and sometimes you hear this actually called SNFs, and that's because their abbreviation is SNF, but sometimes if you're speaking to a provider and they say something weird like, you need to go to a SNF, that's what they're actually talking about. So it's generally where you go after you've been hospitalized when it's not quite safe for you to be home yet, but you don't need the full service of a hospital. And then the other would be some home health care, and hospice care is also covered under Part A. So that's kind of the automatic part what people generally think of when we're talking about Medicare. The next part was added on a little later as our health system got a bit more complex, and they realized that some of these other things are actually very expensive. Things like x-rays, lab tests, going to a specialist, a lot of cancer treatment now is done on an outpatient basis. For example, your chemotherapy, things like that. You just go to the hospital and have the treatment and then you go home. That wasn't covered under Part A because you hadn't actually been admitted to the hospital. So they came up with this program, Part B, that was supposed to be kind of the next layer. Well, you'll notice, we'll get to Part C first, and then the big thing that was missing from Part B was the prescription drug benefits. So there's two other parts. Medicare Part C is actually a way of opting out of the other two parts and wrapping all of your care into managed health care. Like if you've heard about SCAN or Secure Horizons, they're usually offering Medicare Advantage plans, so they do offer some other services. And then finally, within the past 10 years, actually it was probably only about 6 years ago, they decided that actually prescription drugs were a huge cost for people, and so it was really silly for the program that was covering senior and persons with disabilities to not have a prescription drug benefit. Some people were able to get those in other ways through the Medicaid program, but for the average senior person with disabilities, they were just paying out of pocket, and for most of them it was a huge expense. So this is generally, I'm going to come over here now to point at it. So if you are going with Medicare Part A and B, the traditional Medicare, this is often known as fee-for-service Medicare, which means that you go to the doctor submits a bill to Medicare, Medicare pays the doctor. It's the traditional way that most people got health insurance until they invented managed care. So if you get Part A and Part B, you're going to need to get Part D if you would like prescription drug coverage. Part A, you get signed up in automatically. Part B, we'll talk about you have to enroll unless you choose Part C. Part D is optional, but there are some penalties for not taking it. Now, there's a couple things that Part B doesn't cover, and it's not so much that the services aren't covered, it's like there's also high co-payments and things like that. So you can actually get an additional policy to help you pay for some of those stuff in a more, rather than paying it all at once when you need your care, you just pay it on a premium basis. But the other way to do it is to go with Part C. That combines Part A and B into one managed care company, and usually they also take Part D too. So basically you're putting all of your Medicare health care into one company. Now there's advantages and disadvantages to both, and some of it is just going to be a very personal thing in how much you like choice versus how risk averse you are. The big difference here is you can pretty much go to any doctor if you're picking the A and B side. Now you do want to make sure that they are doctors that are contracted with Medicare, because some doctors, they may bill Medicare, but they also might bill you the difference between what the government paid and what you paid, and what they want to charge you, whereas others they have agreed to sit within a set limit. But for the most part, you're not very restricted in who you go to here. Now, Part C, these are all, it's similar to what an HMO is. Some of them are HMOs, some of them are PPOs, so you're very restricted in who you can see. On the other hand, it's usually a little bit easier to manage the costs because they're flat over time. You just pay the same premium pretty much no matter what kind of care you're getting. Now, what I usually advise people to do is, if you have one favorite doctor, a lot of times it's somebody's oncologist, that you just cannot imagine your healthcare without this person involved. Then what you do is, if you're thinking maybe I do want to do an HMO or PPO, you need to figure out what HMOs or PPOs that doctor signs up with. And then you kind of build your health system around that. So it means you don't have a lot of choice otherwise. You may not be able to keep the same primary care doctor. You may not be able to use the same lab that you were using before. But that is, for some people, it's a more effective way to manage their costs. On the other hand, if your doctor doesn't take any of the HMOs or PPOs and only takes regular Medicare, that might be a reason that you're in here. And then you're going to want to look at a Medigap policy to help you with your co-pays, to help you with your co-insurance and some of those extra costs that come in. Some of it is really just kind of a gut feeling philosophical thing, whereas some people would rather have a little less choice and have their care kind of coordinated and all in one group. Other people, that kind of freaks them out, and they would prefer to have, even if it's going to cost more, they would prefer to have more say over what they do. It's interesting, they've done some studies on how people react to choice, and most people are happy if they can choose between one or two things, but if they have 10 different options, it actually doesn't really make them happier to have a choice. And our Medicare program is getting crazy. So under Part C, you usually have a myriad of options. Under your Medicare gaps, you usually have a myriad of options. So it's helpful to just kind of think, is there a provider that's really important to me? And philosophically, how do I want to pay for my care? If you start early in your treatment or early in your care and you're able to find an HMO that works out, that can be the cheapest way. However, if you've been seeing several doctors that you like and you can't get those all coordinated in an HMO, you might not have that option. Let's go on.
What would be an example of a private company?
So some of the same companies that provide HMO insurance, if you choose to do Part A and Part B, and we're going to go over this in a second, they also offer policies. So Part A and B, there's an amount that you pay every month, at least for Part B, but when you go into the hospital or when you receive treatment, you're still responsible for some of the cost. And so if you get one of these, they will help you kind of measure out how you're going to be paying for those. Oh, but do you mean like which companies?
Yes.
I believe like Scan and some of the ones that offer the HMOs also offer the Medigaps. I think if you go to, I guess there's a website at the end of this that has where you can go and look for those. But yeah, and we'll talk a little bit more about the Medigaps in a second. There's a way that they're designed. Okay, so most of you are aware that Medicare open enrollment, which is the time you can change your plans, that is October 15th through December 7th. So if you were in Part C and you hated it and you want to go back to the fee-for-service regular Part A, Part B, you can do that in this time period. On the other hand, if you were in the Part A, Part B and were finding it too costly or it just wasn't working out, you can switch over to one of the Medicare Advantage plans at this time. And it'll come around every year, so yes.
I must be really lost. You talk about these costs. I thought it was all just paid for.
No, and we'll get to that. I think that's one of the biggest misconceptions. People think, oh, when I turn 65, I'll get Medicare and it's done. It's not. So let's go through what some of those are. So we always say that Part A is free, but that just means the premiums are free. There's nothing pulled out of your monthly paycheck, nothing billed to you every month. If you go to the hospital, you're going to need to pay a certain amount. Now, it's all measured out in how much you have to pay, what you're obligated for, and sometimes it's just a dollar amount, like your first hospitalization, it's usually around $1,500, and then subsequent days are a percentage of what Medicare is paying. So it can be extremely expensive when you use it. So I think that's one of the big misconceptions we have in general about our Medicare program. So for some people who did not work, or they, for example, if they just came to the United States and became a citizen within the last couple years, so they don't have that work history that you need, they might have to pay a Part A premium. And for those people, it's $451. It's very expensive. Most people, though, because either they have worked or their partners work, they have some sort of way they've been contributing to Social Security, then their Part A premium is free. Part B, the premiums just actually went down for the first time, I think, in quite a long time. So for people who are earning less than $85,000 or as a couple are earning less than $170,000, their premiums are $99 a month. So that is, even if you don't use any of your health care, that's what you're going to be paying. Now, a couple of you, if you've already enrolled in Medicare, you might be paying slightly lower than that, and that's because if you were already getting a Social Security check, because the Social Security checks have not really gone up, they couldn't keep raising, but it would be slightly lower, as in a few dollars lower. But for anybody enrolling now, that's what they're going to pay. Yes?
Is the deductible on a calendar year or from your
Yes.
eligibility?
Well, it's from when you enrolled. Yeah. So, and then that becomes your annual deductible. So now if you're earning over that, there is a sliding scale on what your premium will be, but it doesn't jump up a whole lot. Like people in the next bracket are paying about $116 a month now. But for most people, this is what they're paying a month. Now the other premiums, Part C, it does vary on the type of plan chosen, and so those are just your HMOs. It's going to be at least the $99, and then as you're rolling in some of those other costs, if you have full prescription coverage, it's going to be a little more. If you don't have much other than what's normally in Part A, Part B, it's probably going to be right around $99, maybe even a little. Well, it'll be at least that. So $99 is going to be your floor. And then Part D, because you have total selection over which prescription drug package you pick, we've been seeing between $25 and $30 a month is about the average, but there are some that are significantly more expensive.
So there's no standard government plan then
For
for
the
Part D?
No. Part D is all private.
Question, is that a cumulative amount? Like all the you pay the 99 and then pay the 30 on top of it, right?
Yes. And that's actually why a lot of people go to Part C, because it kind of rolls those two together. And so sometimes you end up paying, say, $105, $120, where if you took each thing separately, it might be a little more. Okay. And so they do use the income that you had in the last 2 years before you enrolled in Medicare to determine whether you are paying that $99 or you're paying more. Now, if you think that you were assessed too high of a premium and they actually decided that you earned $1 million and you don't think you earned $1 million, you do have a right to appeal the amount that they've assessed you. And you basically file what's called a request for consideration, and if that doesn't work, then you have to file an appeal. Now, for some people, their income might drop at a certain point because maybe at some point they were living off some investment money and then they sold or lost that, their income does drop. You can ask for a new initial determination so that you get down back at that lower level. Okay, now the Medicare savings programs, this is actually a Medicaid program. So for some people whose incomes are around the poverty level, so for most people that's around $16,000 a year or lower, you may also qualify for some of these programs through Medi-Cal or Medicaid if you're in another state. Here it's Medi-Cal. And these are programs where you have Medicare, but then the additional government program helps you to pay your premiums. So they will pay your Part B premium. And right now they're trying to come up with this new plan where they can enroll people in marriage care who are eligible for both, but that won't be ready, I think, until June. Those programs are known, and you would need to apply for it at your county, like your county Department of Social Services, and it's just like applying for Medi-Cal, only you already have Medicare. And you'll hear the workers refer to them as the Quinn B and the Slim B program. That's why we have the abbreviations there. I don't know why people don't like to speak in regular English, but need to turn everything into an acronym. But these are programs for people who qualify for Medi-Cal on various reasons. And so if you have like very low income or zero income and you haven't started taking disability or you haven't gotten your Social Security, you might actually qualify for one of these, so you should talk to your county worker. Okay, and here's the big question on when and how do I apply. Other than this open enrollment period, there's two key times when you apply, or you have the opportunity to apply for Medicare. The first for most people is when they turn 65. And so that you automatically are enrolled in Medicare Part A when you turn 65. And it's the month that you turn 65 with one exception. If your birthday's on the 1st, it's the month before. But for everybody else, if your birthday's on the 2nd, it's the month of that. I'm not sure how they decided that, but that is how it works.
What if it, by chance, it's February 29th?
And you don't have a birthday? I think maybe that's why they chose just the month, so they don't have to calculate the day. Yeah. So you would be eligible to enroll the month of your 65th birthday. Now, for people who are under 65 and are getting SSDI, it gets a little complicated. You're not eligible until you've been on SSDI for 2 years. That's 24 months. So the 25th month, you're eligible. But you can enroll to make sure that it's actually going to take effect 3 months before, or you can choose to enroll 3 months after. You have a 7th-month window. So, for example, if I started receiving SSDI in January of 2012, then I could decide that I wanted to enroll in October, November, December of 2013, or January, February, March, April of 2014, so that January 2014, that's the time when I'm eligible. So you have a 7th-month time in there, 3 months before, 3 months after your 25th month anniversary date. Sometimes I think you could make a government program more convoluted if you tried the way they come up with these counting things when you have the opportunity to enroll, but that is what it is. For most people, it's fine. You realize you're coming on your 2-year mark, just get the paperwork in. And there's also that little 3-month buffer if you didn't quite realize it had been 2 years already that you can enroll without any penalties for enrolling late.
So what's the paperwork that needs to go in? I received a notification that I'm eligible November 1st. And they've started taking the $99.90 out of my disability payments.
Then you're
But I don't have a card, and I haven't done anything to enroll.
If they are already taking, then you are enrolled.
So I need to
you're
just
enrolled in
contact
Part-
them for the card?
You're enrolled in Part B. You should contact 1-800-Medicare if you have no form of card. Although if it was just this month, it's probably in the mail. But you could call them and make sure that it's going to come. But the other thing you can do in this time is you can say, well, maybe I don't want A and B. Maybe I'd rather have the HMO version, Part C. Or you can also start thinking now about if you want one of these Medigap policies to help you with paying your premiums. Well, your co-pays and whatnot. Okay, so what does Part B cover? Besides some of the other outpatient and those types of things, because of the health reform law that was passed, they added a whole bunch of things regarding preventative services. It was kind of an aha moment for the government. They realized if they wanted to actually lower healthcare costs, they needed to incentivize people getting preventative services. Because if they're charging you a lot for cancer screenings or they're charging you a lot for diabetes screenings, you're probably not going to get them. So as of now, most Medicare preventative services are free. If you do have this booklet, all of the services that have a little apple next to it in the section where they list the services, those are all preventative services. What that means is if you're going to the doctor for just that service, they can't even charge you a copay. Now, it does have to be what's on the list of preventative services. They've decided what's preventative. So if your doctor disagrees, you might still have to pay a copay if they decide that you need some other form of service that isn't listed. So it is worth knowing what's listed and what's not. But that was kind of a new thing to Medicare recently to make sure that everybody could get this. So what's not covered by Part A and Part B? Some of these things are things that you would think, well, of course, they're not usually covered by standard insurance. Acupuncture, chiropractic services, cosmetic surgery. Some of these, though, are a little surprising to people. For example, the prescription drugs, you need to get that separately. Long-term care is one that you might need separate insurance for or a separate policy for. And then the ones that get me are foot care. It's like they've chopped off certain body parts and decided they're not quite as important. And that includes eye care and dental care. So sometimes when you're looking at whether you want A and B or whether you want one of the Medicare HMOs, some of those HMOs actually do provide some of these services, and that's how they try to entice people to enroll in them. I've also heard sometimes that they provide strange things like running shoes, just as like a signing up bonus. Okay. So these Part B enrollment periods work very similar. Yes?
When you're speaking about HMOs, are you talking about like Aetna and Blue Cross, how they send that information, they want you to enroll in those?
If it is a Medicare Advantage plan that they're sending, yes. There are a lot of companies that provide them, and so there's Aetna or Cigna that they'll provide regular individual health insurance, but some of them also provide Medicare insurance. So yes. So the Medicare enrollment periods, this works very similar to the way the SSDI period works, only it's your birthday instead of the date that you got the SSDI. So there again, it's 3 months before your birthday month, and then, except for the main difference is you don't have the 3 months after without paying a slight penalty. I don't know how to make that go away. Hang on 1 second. I think I can. There we go. Okay, so with your birthday, if you're not already involved in Medicare at that point, it is very important that you pay attention before you turn 65. You will probably get flyers in the mail, you will probably get things telling you to enroll, but if you don't, you need to call 1-800-MEDICARE because you do need to, by the time it's your birthday, have chosen or have enrolled in a Part B plan. Now, like this gentleman mentioned, if you're an SSDI, they might just automatically do it. They don't necessarily automatically do it for you on your birthday for a Part B. Part A, you're automatically enrolled in. Part B, you do actually have to take a step and enroll in it because you have the choice of Part B or taking Part C. Okay. Now, the reason that it's important is because there are some really stiff penalties if you enroll late. And as you can see in some of the math, it adds up. So what they do is they take each year you were late and they add 10% to your premium for life. So pretty stiff penalties. And you know, this kind of goes to your question. I thought this was all free. Not only is it not free, there's penalties for not being on the ball with it. So if you didn't enroll for 5 years, if you were eligible in 2004 and decided in 2009, in 2009 the Part B premium was $96.40. So they take 10% of that, multiply it by 5, and they're going to add that additional $48.20 to your premium for the rest of your life.
But will they cover your health insurance back that far? Is that what they're doing?
No.
You mean like if you have old
Like
debts?
say you were eligible in 04 and you don't sign up till 09. Are they gonna cover all those health expenses?
Probably not.
No. They like to just
Yeah,
steal
it's a
from
penalty.
you.
It's different than, for example, in the Medicaid program. If you enroll in 1 month, there is 3 months before that you can get covered, but Medicare doesn't work like that.
Is
Yes.
that the same if you're on SSDI for 2 years and you don't go to Medicare?
The penalties work very similarly. Yes. Yes.
So if you're eligible for Medicare due to a disability and you're under 65, but you wait till you're 65, do you get penalized for that?
You could. So one of the ways to avoid the penalty is to sign up for Medicare Part C and HMO or an Advantage plan, because those don't have the penalties. Yeah, you can see there's kind of a general trend in the government to get people to enroll in HMO plans. And that's one thing, is you can avoid the penalty that way. Okay, so here's a problem that happens for a lot of people who are still working when they're 65. They don't necessarily want to give up their employer insurance. So what happens is that their group plan becomes their primary insurance. Now, if you have to pay a high premium from your work, you might just decide that you would rather do Medicare. But if you're not paying the premium, you might decide you want both. So if that's the case, then anytime you go to the doctor, you would use your employer-covered care first, and anything that they don't cover that Medicare would cover, that would cover. Okay, so there is a special enrollment period for these people for Part B. They can delay enrolling for Part B if they can show that they are covered otherwise. Part A, you're automatically put into. So they can decide until they actually end their employment coverage. They can wait until then to enroll in the Part B enrollment period. So if you are 67 and you're still working, you actually didn't need to enroll in Part B, but as soon as you stop working, you have 8 months to enroll. So, There are special rules if you took continuing COBRA coverage that make it more complicated, but I'm not going to get into all of those now. Just know that if you took COBRA coverage from your employer, you should probably ask. Yes?
I have a question about working, not working for a long time.
Uh-huh.
I'm a natural workaholic. I want to go back to work, but
Yes.
I expect to have a terrible impact on my medical benefits. What happens if someone's been on Medicare and Medicaid a year and suddenly goes back to work?
Then you would probably keep your Medicare, and you could also take the employer coverage if it were beneficial to you. Like if the employer you went back to work for had generous employer coverage, you might choose to take both of those. If they didn't have anything very generous, you would just keep your Medicare. When you went back to work, though, you would likely lose your Medicaid because you'd be over the income threshold for it. So Medicare will stay with you, Medicaid will drop away. Yeah.
My question is actually an observation about Medicaid. I've been eligible for it for years.
Uh-huh.
And I didn't have to do anything to stay eligible for this year when they sent out a requalification form back in August.
Uh-huh.
Since I hadn't been using Medicaid, I think one bill in 5 years, I ignored it, just threw it away with all the other junk I get from
Uh-huh.
mail from Medicaid. But it turns out, in order for them to pay the $99.90, you have to fill out this form.
Yes.
This year, for the first time ever. Since I didn't, first thing I found out was they deducted two $99.90 payments from my Social Security check,
Uh-huh.
which was quite a chunk.
Yeah.
And I'm getting back on it, but I doubt it. And they tell me that, well, you can't get back on it for months now. We're not do this until hopefully you die. But my neighbors have hit this too, so it's a really nasty sandbagging job. But,
Yes. Now Medicaid has a habit of because they don't want people on Medicaid, they have a lot of ways of making sure that you get off. But one of the things you should know about Medicaid is when you apply for Medicaid, there's a retroactive eligibility period. And so if I applied this month, if I would have been eligible the last 3 months before, they also need to cover the payments for those months. It doesn't matter how long it takes them to decide that. They may not resolve it until January. But they do, at the point they resolve it, they need to go back and reimburse you for those. Now, is it easy to get that done? No. It's going to take a lot of kind of hassling the county worker to make sure that you actually get those payments made. But you are owed those payments as long as you are eligible.
Or anybody in the room.
Yeah. You got to watch out for the notices from Medicaid.
Medi-Cal or the California.
It's Medi-Cal, yeah. And
Medi-Cal
it's,
and Medicare. They should get that form, sign up for disability.
yeah.
You probably know now by now. A lot of people have got that money,
Yeah.
and they haven't been. You better get that form and get it in.
Yeah, and even if nothing has changed, you still just need to say nothing's changed. And they actually, at the state level, the reason that they send out those redetermination forms is because they know some people won't send them in, and then the state can save money. So, yeah.
Now, I
Yes.
became eligible for Medicare December 1st.
Uh-huh.
So they sent me a card and they said,
It's been designed to make it a little bit less complicated and to make it a little cheaper. Because what happened was there's a certain amount that people would have covered. Well, first you pay, I might just skip this slide and explain how it works. You do need to enroll right away, otherwise you'll have a penalty. Similar, it's not as high of a penalty. As you can see, it's like $6 that's going to be added to your Part D premium for life. But that's still, if you're trying to save money, that's no good. So you do need to pick a plan. You can change your plan every year if you want to during the open enrollment period. But let's walk through how it actually works. So not all plans are the same. The big difference is the drug formularies that the plans have. Now, most of you guys who have been dealing with myeloma are pretty savvy about what kinds of medications that you need. And so you'll need to pay particular attention to the formularies and make sure that they cover medications that you need. Yes?
Are infused drugs that you receive in a doctor's office covered under Part B or Part D?
That is a good question. They are usually covered under Part B in Medicare. For other insurance, it can be, And oral chemotherapy is also usually covered under Part B, which is different than other insurance in California. So for most of the time it's covered that way. Usually it's supposed to be the prescriptions that you have in your house with you that is covered under Part D. Okay, so you need to first of all make sure that they have the drugs that you need on their formularies. And then you need to figure out what the premiums and the co-pays will be. The premium is the monthly amount that you'll have to pay. The co-pay is what you have to pay when you get the prescription filled. So that it can be like very complicated math trying to figure out what you're going to be paying out over the year, because you don't always know how many prescriptions you're going to be filling at any given time. The third thing you want to keep in mind is if that particular Medicare Part D prescription drug plan uses the pharmacies that you'd like to use. Some of them only do mail pharmacies. So it's a lot to figure out. And I think the formularies, the one other thing you need to know is if something is not on the formulary, how much you would be required to pay. For some plans, it's 100%. For other plans, it's a high price, but it's not quite 100%. Okay, so this is how, and this is again where it gets into Medicare is not free. And this is where the slides are a little different than the ones in your packet, because they did change what was known as the donut hole. So you usually, most of them, like I said before, they're about $25, $30 a month for an average premium. The first 320 that went up $10 in the last year, you just pay out of pocket. You get no help from your prescription plan. And oops, I left a typo in there. It should say between 320 and 2,930, you'll pay a co-payment. And that depends on which plan you chose. It could be a $5 co-payment, it could be a $25 co-payment. Then, once you hit that 2,930, this is what used to be called the donut hole, and this is where they used to pay nothing. But as a result of health reform, they're actually trying to phase out the donut hole. So right now, if it's a brand name drug, you pay 50% of that. If it's a generic drug, which are usually a lot cheaper, you pay 86% of that. It's because generic drugs are cheaper. I know, you would think there would be a bigger incentive to make you choose generic, but it still usually will work out to your benefit to choose generic if you have the option. Then after all of your drug costs have reached $4,700, then it goes back to just paying the co-payment, whether it was $5, $25, depending on the plan. So it can be very difficult for people to figure out, how much they're going to be paying. So if you are somebody that has a lot of expensive drugs, what you might just want to count on is that you're paying $4,700 a year for your drugs and then the co-payments, because you'll probably get through that donut hole. Now, for people who don't really have any medications they're taking, they have to do a whole other analysis of this.
Now,
The government Part D, so what is the standard?
It shouldn't probably say standard, but that's compared to having that versus having your drug coverage on Part C. Okay, so that's a difference of the costs. It's tough. So there's a couple options. One is just talk to your doctor. Are these the absolute necessary drugs for me? For most of you guys, that is going to be the case because you're in, pretty specific relationship with your doctor where they have very specific ideas about what they want you to be taking. Sometimes your doctor can give samples. There are some 15,000 for a single person, and then where it says less than 12,510 in resources, that's all of the things that you, like your savings accounts and things like that, but that excludes your home and your car. So if you have, a large savings, you might not be able to qualify for the extra help. Yes?
How long are they going to take to phase out the donut hole?
I'll show you a chart in a minute. It's never going to completely go away, but it will get much better. And then there's where you would call to apply.
Now, do the savings include your retirement accounts like 401?
I'm sorry. Okay, so your prescription plan, if you were already on Medicaid, they already put you into Part D if you didn't choose. But you still might decide that you want to change which plan. The only difference, what if you have other drug coverage? This is similar to choosing Part B if you already have employment coverage. So you can just wait until 63 days after your other drug coverage ends. Like if you had it through your employer, those policies, but they're not going to be selling them. So you can keep the policy that you have right now, but they're not going to sell it in the future. Okay, if you have TRICARE before, so how you decide, first of all, figure out what matters to you most. For a lot of people, it's cost. For some people, it's also the coverage, which drugs are covered, particularly. Okay, and this is what you were asking about before, well, a similar topic. Prescription drug plans must cover cancer medications, although oral chemo drugs are under your Part B. And that's actually a big benefit to people because, like we talked about before, what do you do if a drug that you were just prescribed is not on your formulary? If your doctor can come up with a different one, you might want to switch. You can wait until the open enrollment period, so this would be bad news to find out, say, in March, when you can't do that again until October, but you can. You do want to pay attention to what's going to be happening in 2013 because they do change the formularies. Question there?
Excuse me.